Brief 2 moments. The first thing I want to do, and Sally's going to mention it as well, on your tables there's a leaflet called 1 in 8 Male Rotarians, Prostate Cancer Foundation Australia, and a wonderful man, Roger Climpson, who's a newsreader and personality from Sydney, is there, and he's been there supporting Prostate Cancer Foundation for many years. Rotary actually kick-started, and Dick Wilson, Dr. Dick Wilson, who's here today, Rotary actually kick-started the Prostate Cancer Foundation of Australia, and we'll get Dick back at some stage to talk to more about it. The second comment that I wanted to make, and I'm not going to say too much because I'll leave it to her, a friend of ours and a Rotarian friend and a friend of a number of members in the club has been, I won't say battling because he's actually winning with prostate cancer. And one of the things, amongst anything, he's ignoring chemo and all the chemicals and doing his own thing with diet and riding, exercise, turning vegan, etc., etc. But it's working, and for him, that's great. And to each individual, it's terrific. But one of the things he actually puts down to his success is not the oncologists and so on who want to keep feeding him chocolate and so on. He actually puts it down to the prostate care nurse that is assigned to him to help him through his journey. And so we hear a lot about the pink test and the McGrath Foundation, but what we don't hear enough about, we're going to hear something today, is about the wonderful work of the prostate care nurses. So please welcome Sara.
Well, good afternoon, everybody, and thank you very much for the warm welcome, Peter, and to Adriano and Peter and Barry. Thank you for the invitation today. I was reflecting driving into work this morning that the last time I went to a Rotary Club meeting was 40 years ago, and I went to a father-daughter night at Kadina Rotary Club, and I distinctly remember it because I'd had braces put on my teeth the day before, and I felt like I was like this the whole meeting. So after 40 years, it's lovely to be back. And straight teeth. So I'm here today to talk really about the nursing program that the Prostate Cancer Foundation of Australia supports. But just a little... Sorry, I'm just trying to advance the slides. Closer? I might. No, it's not working. Excuse me, I'll just use the arrow, so I'll just have to lean over. So just a word on the foundation itself before I get started on the nursing program, because as some of you know, I could talk about the nursing program all day. So the Prostate Cancer Foundation of Australia, as you've already heard, was established 25 years ago by a couple of fellas at the Lane Cove Rotary Club. Roger Climpson was one. I grew up watching him on This Is Your Life and Australia's Most Wanted. And he and some very forward-thinking colleagues set up the Prostate Cancer Research Foundation and trying to raise awareness and raise information for men diagnosed with prostate cancer. And out of that grassroots collaboration has grown the foundation that we've got today. And our mission remains the same, and that really is to reducing the impact of prostate cancer for men and their families and their communities across Australia. And I don't believe that mission will ever change, and that's really what puts a spring in our step every morning. So how do we actually do that? So from a Prostate Cancer Foundation of Australia point of view, there's 3 pillars. So a major pillar we have is our research arm, and with a new CEO coming on board last year, Professor Jeff Dunn, who has taken over the research portfolio, we launched a new research strategy for the next 5 years with 5 key research priorities. And last year we announced $1 million in 3 new projects, plus the others that are still ongoing that we've supported previously. We have an awareness and support arm, and we're very involved in advocacy. And many of you would know the rebate for the multiparametric MRI for prostate came out of a lot of that advocacy work. And then we have the support arm, and through that we look after 170 plus support groups across Australia in every state and territory, so grassroots support groups that are blokes helping blokes, peer support led. It's a very valuable part of our program. and it keeps us in touch with grassroots, because that's where the organisation grew from. And for us, it's important that we never lose contact with our grassroots supporters. And then a very important part of the program, from my perspective anyway, is our prostate cancer nursing program. So I'm a nurse. I've been nursing for 30 years in South Australia, and have spent a number of those years working as a prostate cancer specialist nurse in the southern region of Adelaide. And in July 2018, I joined the foundation to run the nursing program nationally. So a little bit of history on our nursing program. Many of you would have heard of the McGrath breast cancer nursing program, established quite a few years before ours. We started off in 2012, which doesn't seem that long ago, but I do recognise it is actually 8 years ago. With a pilot program, we had some community funding. We set up a pilot 3-year program with a nurse in every state and territory in Australia. That program was independently evaluated by representatives of the Queensland University of Technology, and out of the feedback and the analysis of that program, the results were so good that some forward-thinking members of PCFA wrote to the federal government in 2014 and asked whether they'd like to come on board and fund a number of nurses as well, similarly to how the McGrath model works. So in 2014, we added 14 Commonwealth-funded nurses to our group, and I was one of the nurses fortunate enough to get a grant to set up a prostate cancer nursing service in the southern region of Adelaide then. In 2015, we gained our first community-funded nurse, so biggest ever blokes lunch in Shepparton in Victoria, raised enough money to put a nurse in their local community for 3 years. That nurse is still there, and they've just appointed a part-time nurse on top of that full-time position, all with money raised in that Shepparton or Goulburn Valley community, which is amazing. We now have quite a few other community-funded nurses across Australia. Then in 2017, when we went back to the Commonwealth Government because our 3-year funding was due to expire, and we were really pleased they announced another 3-year term and funding for another 14 on top of the 14 we already had. And last year, in actual fact, it's not really last year. Oh, it would be in budget sort of April. The Commonwealth Government announced another 3 years of the 28 they fund, and further funding for another 34 nurses over the next 3 years. So from a program that started with 12 back in 2012, we'll be sitting around the 80 or 90 mark in the next couple of years. Currently, we estimate about 1 in 3 newly diagnosed men has access to a specialist nurse across Australia. So we've still got a long way to go, but we've come a long way when you look at that short time frame. So in terms of the program itself, sometimes people are worried that they'll raise money in a community and they'll put it towards a nurse, and a nurse will be dropped in at a hospital and the executives say, yippee, here's a free nurse, off we go. It's actually quite a lot more structured than that. So we have quite a robust expression of interest process for appointing a nurse. We don't actually employ any of them directly, but we provide financial support and a framework to the sites to employ. So the sites have all the HR and governance around the employment side, but we provide the framework they practice under and a set of competency standards that they conform to. When a nurse first starts in a newly appointed site, the first 8 weeks is quarantined to do quite an extensive service mapping exercise that we support in. We have a template for that. And that's to make sure that that nurse, when they proceed off in their working life, is dedicating that role to meeting the unmet needs of the patients. So it's not system breakdown or areas that are a bit underdone. It really is about the unmet patient needs. So the service mapping involves the nurses going out. They look for any service that already exists in a health service area for men with prostate cancer. They interview other clinicians, they interview men in support groups, they look at all the community services, and they really make a list of all of the positive findings, what already exists in our health service for men with prostate cancer. That leads to the next step, which is what doesn't exist. And once they've developed that list, they then develop a strategic plan for their first 3 years of how they're going to set up their service. So a lot of planning goes into that. They don't just hit the ground running on day one, and we've learnt that it is much better to plan very carefully so that the hard-earned funds that go into supporting these roles are truly going to the right type of nursing care. So they're involved in all stages of the disease, from diagnosis, localised disease, right through to metastatic or advanced disease, and they become a really important team member working with other clinicians. So they work with urologists, with oncologists, with other specialist nurses, with allied health psychologists, physios, but they often become the key contact person for that man and his family. So they're the kind of link, or the mortar really, between all of the bricks that makes up that care. Oh, it is working now. So having said all of that, people will still say to me quite often, but what do they actually do? So I've tried to break it down a little bit. The first thing that they attempt to do in as many cases as possible is be there on the day of diagnosis. Now, in the public sector, that's easier because often men are getting the results in a busy outpatient clinic area and the nurse and the doctor are there together on that day. In private practice, it's a little bit different because you're getting results through private rooms, and then usually there's a referral pathway that follows. But certainly for men in the public system, the nurses try and be there in the room on the day of diagnosis, and they provide a lot of support in terms of information about what does this mean, what happens next, what other tests need to be done, and a lot of support in those first 4 or 6 weeks where there's other tests happening and a decision needs to be made. And one of the good things about prostate cancer is that often there's more than one treatment option. Same success rates, but treatment delivered differently and side effects are different. But for men who have to make a decision when there is a choice as to what decision to take or what treatment to take, that is incredibly challenging. And for many men I've cared for have said to me it is the most difficult decision they've ever made in their lives. And so the nurses are very involved in making sure when they get to the point to make that decision, they've had plenty of time to talk through options, they've had good time with treating clinicians, they've got a good understanding of the pros and the cons, and they feel they're making the right decision for them. Then men go off and have their treatment nurses help navigate the system and coordinate their care into that treatment pathway, and then at the end of the treatment, link back in and provide long-term follow-up care. Now that's physical care, psychological care, it can be intermittent, it can be not for 6 months or 12 months, it's totally tailored to what that man and his family feel they need. It's moving along. And really the challenges that nurses focus on helping men with is the physical issues, particularly after treatment, issues with pain, issues with lethargy, fatigue often comes with hormone therapy and other advanced prostate cancer treatments. Men can have urinary issues, urinary leakage, bowel issues and sexual function issues that are debilitating and long-term for many, many men. And the nurses are very, very involved in helping men deal with that situation and helping them get consultations and strategies to try and manage as best as can be. The financial issues, returning to work can be really challenging, and nurses are involved in helping and trying to access resources and giving guidance and being on the end of the phone for a phone call in relation to anything. A lot of their work goes into minimising confusion about the health system. You're jumping in, you're seeing different healthcare professionals, some of the titles you've never even heard of before, and particularly in the public sector where it's fragmented. And it's very easy to fall off and miss an appointment or not get a letter or something like that. And very, very involved in the psychosocial issues related to prostate cancer. So a prostate cancer diagnosis brings fear, sadness, loss of hope, identity issues, and feelings of and issues with intimacy that go along with sexual function issues. So the psychosocial issues are just as debilitating as the physical, and nurses are very focused on making sure both aspects of care are covered. Now, another important part of what the nurses do in addition to their day job is they're involved in community awareness and education. And many of them do this in their own time as a volunteer, and they average 4 to 5 events a year. So these are some of our nurses who are out delivering education events. They're manning information stalls at field days and community affairs on weekends, and going to support groups and giving guest speaker presentations. And it's a really big part of what they do, and full credit to them, because often they're late nights. Some of our nurses in regional areas will drive several hours after work to give a presentation at a support group in another town, and then drive all the way back and get home at 10 or 11 o'clock at night, and then head off to work the next day. But they all see it at that whole awareness side of things as incredibly important in what they do. They're also involved in research at their own sites. A couple of research projects last year. Our nurse Gay in Ballarat's developed a 90-minute program for men and partners, helping them deal with the sexual dysfunction and intimacy issues that can come from prostate cancer treatment. She was a finalist in the Men's Health Awards in Victoria and won a $20,000 grant to evaluate her research. So she runs that on the side in addition to her day job. And another nurse in Shepparton managed to get the GPs and the urologists and the oncologists all together for a series of meetings to develop a care plan for men on hormone therapy in that district. And all of the surrounding district want to get their hands on that care plan now. So it's just a small example of what they do in addition to their hands-on nursing care. And we're also involved nationally as a group in research. So last year as a group we put together we did a study on the survivorship or after treatment experience for men and where the gaps are in the system, and we were published in the Journal of Clinical Nursing last year, which was very exciting for all of us. So importantly, and I'm sure in this room you would understand the importance, when you're dealing with a multi-million dollar program, it's incredibly important to make sure it's independently validated or evaluated, and we commission an independent evaluator. It's a directive from the Commonwealth as part of our funding every 3 years to make sure our program is running efficiently but is also effective out there at the coalface. The current final report for the current funding term is due in March, but the interim report showed that last year we looked after 8,000 newly diagnosed men and their families, in addition to all of the men who are already in our service. The patient surveys that went out, of which there were hundreds, came back saying that the prostate cancer nurse themselves, and it aligns with what Barry was saying, the patients reported the nurse themselves as being the healthcare clinician that had the greatest impact on their overall state of health and their ability to manage their own health going forward. I'll just skip along because I'm pushing the time factor. 92% were satisfied with the appropriateness of care in terms of length and time and timeliness. 98% of our nurses have completed a prostate nursing care course at university, and another 70% have completed other postgraduate qualifications at grad dip and master's level. So in summary, the prostate cancer specialist nursing role, which is one I know very well, having done it for many years, it's not a basic nursing role. It requires advanced skills and knowledge, and that really aims to make sure that our care we provide meets both the physical and the psychological needs of men and their families. The nurses are really skilled, and the role is broad and varied, and you never know what a consultation or a phone call will bring. You have no idea what's coming at the end of that phone call when you pick it up, and then you need to act upon it. The nurses themselves in our evaluation most commonly describe what they do as an incredible privilege, and it is an incredible privilege at a vulnerable time of a person's life and their family's life to be invited in to help them deal with where they're at and what's coming next. And in my 30 years of nursing, the time I spent doing this role is the most rewarding role I've ever done. They're a wonderful, dedicated team, and their network is incredibly strong, and it really is my privilege to present their work to you today. And I'm happy to take questions if our timekeeper is... Just while you're all thinking, I do realise, because my brief was to talk about the nursing program, that I didn't actually give an overview on prostate cancer itself. So for those in the room who are not aware of the current statistics, and the statistics have just been updated in the last month or so, it's now 1 in 6 men estimated to develop prostate cancer by the age of 85. 3,500 men die every year in Australia from prostate cancer. It's a myth when people say it's a disease men die with rather than from, when there's 3,500 men dying. About 20,000 men a year are diagnosed. We talk about an average of 10 men every clinic hour. So if you look, even the time this lunch has taken, there'll be 2 tables worth of men have received their prostate cancer diagnosis, and 200,000 men in Australia are currently living after a prostate cancer diagnosis.
Here's the most unfair question you'll ever get. If the Lane Cove Rotary Club hadn't did what they did all those years ago, really, what do you honestly think, where would we be now?
I don't even want to think about it, really, to be honest, Eric. It's unfathomable. When you look at so in terms of the work of the foundation and the research arm, you know, treatments have changed because of the research that PCFA have supported and continue support. The resources we have, so we now have a suite of evidence-based, good quality Australian-based resources that we can hand out to men diagnosed with prostate cancer. They get passed around families, nurses and doctors write notes on pages. That wouldn't have existed. The support group network, you know, those 170 odd support groups around Australia who are blokes helping blokes and families helping families, never underestimate the value of peer support. And lots of blokes feel more comfortable talking to someone they play bowls with, or they play golf with, or they meet up with at the support group network. That network wouldn't exist, and that would be the greatest tragedy of all. And of course the nursing program wouldn't look in any way like it looks now. So the nurses out there we support, that's all they do, is look after men with prostate cancer and their families. They're not involved in any other cancer streams. They're totally dedicated to trying to improve the quality of life of men diagnosed with and treated for prostate cancer.
I'll ask, sorry, Pat Christie's got a question. You can stay seated.
I was diagnosed with prostate cancer nearly 2 years ago, and can I say to every chap here, have a test every year, or it will be too late when you're diagnosed, because an awful lot of us are going to have it. The treatment, yeah, it's got its moments, and I hadn't even heard of your organisation over the 2 years. My apologies. Thank you for what you're doing.
Thank you. Thank you for sharing that.
Sally, Pat's just raised an interesting question, which we touched on before lunch, and that's the issue of diagnosis and treatment. And often in the media, and only this week, there's an article about too much focus on treatment and perhaps over-treatment rather than diagnosis. Do you want to touch on that?
And I think the article that was in the paper this week had a tagline of over-diagnosis. And we were talking before, there's a difference between over-diagnosis and over-treatment. The Australian guidelines, which are NHMRC supported, say that men should have a blood test, a PSA blood test at 50, unless they have a family history, so a father or a brother with prostate cancer, where they should have their baseline blood test, just a blood test, at 40. Then 2 years thereafter until the age of 69. I think it's good to know. So you can talk to your GP about prostate health. If you decide to go ahead with a PSA test, it's an indicator of a risk. Then there are other tests and MRI scans and biopsies that can follow depending on what that risk looks like. Many men have said to me who have been diagnosed with prostate cancer, and it's low volume, slow growing, and they go down a path of surveillance, active surveillance, or watching very carefully, that they're happy with that and they feel very happy with that decision, but they're glad they knew about it and had the opportunity to make that decision. So I think it's grey, and I think, you know, when you put something in the paper, you can put a slant on things any way you want. My advice would be, if you have any concerns about prostate health, talk to your GP and take advice from there. Every case of prostate cancer is different, and when it's a common cancer, people will talk to each other and they sort of make that assumption that it's all the same, and it's not. Every single case is different and needs to be looked at on its merits.
Hang on, there's a microphone coming.
Is there a common test? Like, women have breast cancer screenings. We get told by the government, we get little letters and off we go and we go through this horrible procedure. Is there a common test that you can universally encourage men to have and that is government supported?
So we don't have a national screening program for prostate cancer. The PSA blood test is the most commonly used indicator. It's not perfect, but at the moment it's the best thing we have that's relatively cheap and usable. But that's why we've got the national guidelines out there of when to start having that discussion. You will get some false positive, or sometimes so if men have an infection or some inflammation in the prostate or a really large prostate, you can have a PSA test that comes back raised as well. And so it always leads to other investigations required. But in the absence of anything else, it is the best we have currently, but it's not perfect, and we know we need something better. We just don't have it. Yeah, we're working on it.
That following on from that question, I guess that without wanting to raise a league ladder or make it competitive, but the incidence of prostate cancer versus, say, something like a breast cancer prevalence per thousand, is there a comparative rate?
I'm always hesitant to give the statistics because we don't ever want cancer to be a competition.
Absolutely.
But it's on par. And every year it's one's more slightly than the other. So I think currently more men die of prostate cancer than women of breast cancer, marginally. And the diagnosis rates of prostate cancer and breast cancer are on par with each other. The average age of diagnosis, of course, with breast cancer is lower. The average age of diagnosis with prostate cancer is 67. But in terms of diagnosis rates and death rates, pretty much the same.
Thank you. David Egan. Speak loud. No, there's a microphone.
Oh, okay, thank you. I'm just wondering, are the rates going up or down over time?
It varies. Certainly when PSA testing became available back in and Dick, you might be able to correct me on this, but I reckon it was around about the 80s. Late 80s when PSA testing came on board, you certainly saw diagnosis rates grow because many men were having this blood test available. So I think it's steady. But just because it's diagnosed doesn't mean it's not, it doesn't mean it's not out there in the community. So you'll have some communities with a really high mortality rate, so death rate, but a lower diagnosis rate, because less men are getting tests, it's not being picked up early. And then you'll see other sectors in the community where the diagnosis rate is really high because many men are having their testing done and being picked up, but the death rate is low.
Rob Thomas.
Wherever for all cancers, do we know a cause?
We don't know the cause for prostate cancer. In terms of risk factors, because this often pops up in the media as well, the only two proven risk factors for prostate cancer with gold standard evidence are age and genetics. You can't do much about either, sadly. So that's why awareness is important.
I think. Oh, one last one. It's all right. Okay.
So, Karen Foster, I'd like to thank Rotary. I was the former Prostate Cancer Foundation manager for South Australia and Northern Territory. I'm handing over to Kathy McGain, who's just over here. And I really thank Rotary for the Trailblazer event, and we're very grateful for everything that you put into it. I just want you to confirm, and I always get it wrong, there are something like 185 breast cancer nurses across Australia, thanks to the McGain Foundation. And we have, comparatively, maybe
54.
54. So
as of last week.
We have a third of the people on the ground looking after men with prostate cancer. So 54, thank you very much. And in South Australia, here we are, we've got 2 people. So everything that you've done for us, Rotary, thank you very much, is going to increase those 2 people. And it's not a competition, as you said, but what you are value adding to South Australia and our national program for nurses is enormous. Thank you very much.
Thank you, Kat. Thank you, Karen.
Excuse me, Peter.
Don't go, Sally. Don't go.
Excuse me, Peter.
Is
Can
it-
I just quickly say something? Just quickly.
Very quickly.
I just had just an example for some of those people that might not want to go and have a test done. I was with a client on Monday. Yes, it was a public holiday. He was coming to Adelaide yesterday. He had no symptoms. His PSA level was high. His doctor did a regular check because he's 67, and his PSA level was high, so he was having a biopsy done yesterday for prostate cancer. So it doesn't, you don't have to have any symptoms. There probably won't be, but he's very grateful that his doctor did that, and he was off having his biopsy yesterday. So I just wanted to...
Thank you, Helen. Thank you very much, and thank you, Pat, and thank you, Karen, and others who have supported. I wanted to particularly in thanking Sally for coming and giving us this wonderful presentation. Also thank Barry for both of them highlighting why we're here and why we're doing Trailblazer and the benefit of Trailblazer. Barry's given us some numbers, Sally's given us some facts and some human motivation. So the next time someone taps you on the shoulder and says, can you help out with Trailblazer, think about today's presentation, think about the issue that we're talking about, and maybe, perhaps, you might give some time to help Trailblazer and help Prostate Cancer Foundation. We've already given enough money today to PCFA, so we're now going to give some money to End Polio Now. In appreciation of the presentation, Sally, a donation's been made to ending polio in your name. Please thank Sally, Sara.